So I want to talk about today building public health research capacity and culture in local government. And I speak as the public health theme lead, and I'm hoping very much as the ARC is renewed in 18 months' time that the theme lead will be even stronger in the next iteration of the ARC. So I work at the Centre for Health Services Studies at the University of Kent. So on to more.
Lindsay, sorry, you've muted yourself for a second. Can you unmute?
Sorry, I'm back now. Can you hear me now?
Yes, we can.
Yes, good. I don't need to tell people who work in local authorities this, but it is still something that is not very clear to many people working across the health system, that local authorities since 2013 have been responsible for the health of the public, for health improvement. And this means the NHS is no longer responsible for that. The NHS has a role in that, but it is not primarily responsible for the health of the public. So the monitoring of the health of the public and the design of interventions to improve the health of the public is the role of local government. Seems really obvious, but it is not well known. These are what in Medway Council Medway Council has developed this graphic, which we like because it demonstrates what we call the building blocks of health, and these are actually the determinants of health, but we use the word building blocks because the general public gets a bit glazes over when you say determinants. These are the things that make a difference to people's health. The health service has a role, but probably only around 20% of the health of the public is part of what the NHS can do. The rest of it is all about our environment, our economic, psychosocial environment, physical environment, and this is why the responsibility for health of the public was returned to local authorities. And I say returned because it used to be before 1973. It used to be 1974, I think, the responsibility of local government, and it went over to the NHS then. The idea is that local authorities are in a position to influence these things in a way that the NHS is not, and that's why it was moved over. So
sorry, you muted again, Lindsay.
Am I back now?
You are back now. I think there's a
Every
key
time
somewhere.
I try, and yes, it must be one of my keys. Yeah, sorry about that. It's because I keep pressing the space button to move on to the next one. I should use a different one. Sorry, being a bit rubbish. So why should local authorities build research capacity and culture? It's not something they routinely have done over the years. They do use research. Every local authority will say they use research evidence to a certain extent, at least. It's not the only thing that guides decision making, but it is, local authorities do use it. The problem and the benefits of building research capacity and culture are as follows: better decisions, better value, better, more transparent justification of how public money is used, taxpayers' money, better outcomes of the public, better recruitment and retention of staff. And the evidence for these being important are very clear if you go to the NHS or if you go to the private sector. Any big company will have an R&D department. It would be a no-brainer. It is a no-brainer to have an R&D department because they know they have to innovate, they have to get better all the time. And of course, the NHS has taken that on only in the last 30 years or so, the idea that we should be constantly trying to build a culture where innovation and creativity is valued, and that we test new ways of doing things all the time, rigorously, and that we base our decision making on these very clear decisions with a very clear, transparent link to the evidence. Now, it seems it's a no-brainer in the NHS, it's a no-brainer in the private sector, but traditionally, local authorities have not done a lot of it, and not all had a strong research culture. And so did I miss one there? No, I didn't. So what does a local authority with a strong research culture look like? Well, broadly speaking, it's an organisation that acknowledges at the organisational level the value of using and doing research. You know, this would be any private sector company would say that is what they do all the time, and it supports and encourages the staff to use research evidence, to develop ideas about innovation, think creatively, to seek funding for research, and preferably provide some funding for research, and to deliver research, to actually do the research. So what assets does local government have that would make it a good place to do research? The workforce in local government is highly educated. Many of them have research experience. There are people with PhDs working in local government. The workforce, a lot of research experience, and I have to say a lot of enthusiasm for using research and taking part in research. One thing that we found when we did a study in 2020 was that it was not difficult to enthuse the public with the idea of evidence-based decision-making. Members of the public, just about everybody who took part in a study, and there were, a couple of dozen people, were very, very clear that they thought it was a good idea that that councils did research. And that's important in councils because they're democratic, unlike the NHS. And depend on public support completely. Also, councillors that we interviewed were very eager for evidence. They wanted to know how to make best use of very limited funds. They wanted to know about what to invest in. They wanted to know what to disinvest in. And so these are the assets that they've got. I mean, there are others, but these are the most important ones, I think, that mean that it can be done, research in local government. So why doesn't it happen very much? Well, the biggest problem is, well, there are two very strongly related problems. The biggest problem is that there are a huge number of statutory responsibilities, things that local government absolutely has to do by law. It just can't even think about not doing them. So it has to do all those things, and it has to prioritize those things. Otherwise, just people get sacked. Everything goes horribly wrong. They have to do it, and related to this, the main problem is that what happens is that this is how much is left after local authorities have done this. That there is even delivering statutory responsibilities are sometimes difficult to get within budget. So anything else is not a statutory requirement, and research is not a statutory requirement. Anything else has about 10 pence to work with, and that's the main barrier. The other problem is, I mean, there are many other barriers too, but this is another problem, is that that the pinnacle of reaching the evidence and the top of that mountain is very, very long way away, and research timelines are very slow, and they're not fast enough for councils, and that's a really massive structural problem that we are still dealing with, and we have not found the answer to, because doing rigorous research takes ages. And one of the other most important barriers is that it's getting better now, but the National Institute of Health and Care Research, much as I would willingly die for the organisation, it's fantastic, but it has a tendency to produce things, outputs that are not comprehensible. They're in Bulgarian. I think that's Bulgarian, something Cyrillic anyway. And so are really incomprehensible to people in local government. They're just about comprehensible to people working in the NHS, and just about comprehensible to people working in health research settings. Oh, they're pretty comprehensible for them, but they really, really do not apply to people working in local government. And, for example, repeated references to patients, for example. And as soon as somebody in local authority sees something about patients, they switch off and say, this isn't for me. And so, that's a big challenge, and things are hugely improving. I don't find I have to do quite as much translation of the Bulgarian into local authority speak as I used to. So there's just some of the barriers. I'm sure some of you can come up with others. So what's been happening to try and change this? Now, even before public health moved to local government, the Public Health Research Funding Programme was launched. Before that, all NIHR research programmes were very much focused on NHS research, on patients, clinical research. And did not really focus very much on public health research. For example, until then, you would have to have, and even actually more recently, I'm not sure when it changed, but relatively recently changed, needing to have an NHS sponsor for your research. Now, every bit of research has to have a sponsor, an organisation that is ultimately responsible for delivering the research and providing the governance for the research. But obviously that's not relevant for local authorities. Now, it didn't matter in 2008 because public health research was done within the NHS, but obviously after 2013, there's it wasn't relevant. There's no way. It was really difficult to get a sponsor. Well, you could do it, but it was all a bit messy and difficult to do. I've tried to do it a few times. Well, I've done it a few times. And basically, despite the fact that even up to 2018, the public health research funding did fund a lot of public health research. Broadly speaking, it was extremely rare for the research funding to reach local government, i.e. the organisation was responsible for public health. So everybody thought, well, this was a problem, but it was quite difficult to turn this whole, did need a lot of change. And in 2020 really was the time when things really started to change, 2019, 2020. And at that point, the Department of Health and Social Care funded 15 across the whole country, embedded public health researchers in local government. So it was only one for each region. There was one in KSS at the beginning, and a tiny bit of consultant time. It was only half day a week per region. So we're talking a tiny amount, but it was a little bit to start to pump prime the system, and it was actually really helpful. The clinical research networks, which are soon won't exist, it's all changing at the end of this month, which were the research delivery arm for the NHS originally. So they're the people who employed the research nurses to go and obtain consent from patients in clinical trials, etc. I mean, they started to increase their support for local government research. And I have to say that, in the KSS clinical research network in our region was very, very good. It tried its best. It really, gave as much as it possibly could to try and support local government research, and it put a lot of energy into it. And there was a bit of money, but not huge amounts. Then in 2020, the research I referred to earlier that I did with colleagues in Kent and Medway, I'm not sure how any of you here, but there were many of you involved in that. We got some funding for 6 months to do some work to understand the assets and barriers to doing research and start to suggest ways of tackling the problem. And there were 13 projects around England, and I led the one in Kent and Medway. And the NIHR paid attention to those results. It made a huge change. And in my next slide, I'll talk a little bit more about that. Also along the same time, I mean, it was a bit before 2020, really, the NIHR Research Design Service, which many of you will have heard of, doesn't exist anymore. It's now been replaced by the Research Support Service, which has got added value to the RDS. It became more aligned to public health research. So people in local government were encouraged to go to the Research Design Service and ask for advice about how to design their studies and ask for support for submitting bids to NIHR. And there was a lot of progress made, and there were a couple of other bits and pieces that went on at the same time. But those things really changed in 2020, and so what is available now is a lot more. Really, from almost nothing in 2018, 2019. So these slides I think will be shared, and so I have actually put the links to all these things in for people's future reference. And I'm not going to go into great detail about all of them because the information is all available and is not in Bulgarian anymore. The NIHR Local Authority Fellowship Programme, which provides fellowship from short attachments, what are called sparks, which are 3 to 6 months, to a year. I think people do it very part-time. Short attachments that people can do, they're usually a day a week or something, for people to take advantage of training, take advantage of learning, being in sort of internship type things, paid internships in a different setting, in an academic setting, if you work in local authority, for example. Then there have been some specific pre-doctoral and doctoral fellowships launched, which are specifically for people working in local government, because the NIHR fellowships, PhD fellowships, which have existed for years, since the NIHR started up 20 years ago, are very focused on people working in clinical settings. And it was recognised that they needed something special for local authorities because frankly, clinical people do not judge public health research very well. And so you make sure you've got a panel deciding who gets fellowships who's actually informed about local authority public health. Then, of course, the NIHR Health Determinants Research collaborations, and these are big chunks of money that are awarded competitively, and so far they've awarded 30 in across the country. At the moment, I don't think it sounds as if NIHR is not particularly minded to fund any more, but things may change. And in the southeast, in KSS, we're really lucky. We've got one in Medway and one in Surrey now, which has just started up in September, October last year, I believe. There's public health interventions responsive studies teams. The first teams have been set up, and they kind of the local authorities have to apply for money to be able to evaluate one of their services, and they apply for money from NIHR for an external team to come in and evaluate with them, preferably co-produced, but basically providing the staffing and the expertise to actually do an evaluation in their local authority, recognizing that they just don't have the spare staff to do this stuff. last year, the NIHR Research Support Service was set up, and it's got a special branch called the Specialist Centre for Public Health, which has been set up, and now it's got several roles. I've got a slide about it in a minute, but basically, if you go to this research support service with a public health project, you will get some people who understand public health research. So you won't just get somebody who's only ever helped people with clinical trials, because it's a different language, very different disciplines. And the other thing I would like to very much draw attention to is the integrated clinical practitioner academic program, and that / practitioner has been added in the last few years, recognizing that people employed by local government are not clinical, they don't do patients, and they should have access to this academic program, by which people do get access to a mentor, they get access to do a project or develop a project. It's usually not actually to do a research project, it's usually to develop an application for one. They get lots of training to help them to do that, access to mentors, access to a training course to help them do that over a period of 8 or 9 months, again for free. So those are some of the things that are available. I haven't put all the sparks that we've had here, the short placement things on here, but I just wanted to emphasize that now in Kent, Surrey, Sussex, we are doing really well. We've got 2 HDRCs, Medway and Surrey. We've got we've had at least 2 PhD fellowships. I think there's only been the 2 local authority fellowships. We've had at least 2, and I think maybe 3 pre-PhD fellowships, pre-doctoral fellowships, but then a range of sparks as well. And we are considered at national level to be quite cool, in the sense that we've got something everywhere in all the local government. There are the six upper tier or unitary councils delivering public health in KSS. So I think that's something to be proud of. We are considered quite good. So I just wanted to emphasize the role of the Research Support Service Specialist Centre for Public Health. It's still growing. It's still a child, I would say. It's not embryonic. It's not quite reached adolescence yet, but it is providing specialist support for developing research projects. So you can get free support. Anybody can get free support for a research project, developing a research project, even if it's just an initial idea. I mean, they might send you away and say, do some more thinking about this, and this, but they won't turn you away. They will help you develop the ideas and the project. Local authority research practitioners, actually I put LARP, didn't I, in my previous slide without having explained it. Sorry. Local authority research practitioners, these are, I think there's some in the audience. They fund, it's not hugely funded, it's half time. They fund people to work in local authorities who are basically, their job is to support research, development of capacity and culture in the organisation. More on that in a minute. The other thing that Research Support Service Specialist Centre is doing is developing governance. There's big project on the moment to help develop governance frameworks for local authorities, because it's really challenging in research naive organisations to make sure that research is done properly, safely, legally. And it's quite difficult. I mean, my experience with the HDRC in Medway, for example, it is quite challenging to make this all work. It's not straightforward. The NHS has got all this in place, and they've got R&D officers who help clinicians who want to do research develop everything. But local government is much more difficult. And so Support Service is working at a national level to develop those frameworks, and will communicate their completed work when they're doing it. But they are very much working with local government on that. Also, research support for research delivery, the actual collecting of data. You know, how do support for systems for collecting data, systems for doing analysis. You know, that's all coming in the future. The other thing that's about to happen is, and I've heard that the job descriptions going out now, the adverts going out quite soon, is local authority engagement practitioners. And these are going to be people who work across several local authorities to keep them connected with each other, keep the local authority research practitioners connected, to keep everybody interested in research in the local authority connected, and make sure that people have got access to the support and the need, and the access to building collaborations. So what we've been doing in the public health theme. So as I said earlier, I'm the theme lead for public health in NIHR ARC KSS. And we've very much focused, we've got a number of actual ongoing research projects, but one of our big focuses is developing research capacity and culture in local government, and recognising that what the RSS is doing doesn't go far enough. And we, in the theme, focus on helping people navigate NIHR. In other words, just knowing that they can go to the RSS, Special Centre for Public Health, for help, understanding where to look for grant bids, calls for funding, navigating the forms, that sort of thing, that for applying for funding, understanding the support that's available. We focus very much on facilitating collaborations, bringing together people between academia and local government, and indeed, where appropriate, the NHS, where appropriate, voluntary and community sector organisations, to make to help people build teams, really, to do research. We've set up the Public Health Research Network, and more on that in the next slide. And also for the RSS local authority research practitioners who are not funded by the ARC, but it's very much a recognition that their job is extremely difficult. Maybe Tara, I saw you were in the audience, you might disagree, but I think their job is extremely difficult. They've got limited resource and loads they could be doing, and half their time, half a job to do it. So I'm very keen to make sure that we maximise the potential of those jobs, to support people doing that role, to make the best of it. So Public Health Research Network, and its purpose is to help build collaborations and sharing and testing research ideas. We have these monthly meetings where we have a short presentation. They're relatively informal. They're safe presentations, safe places for people to bring ideas. Don't have to be finished projects. So they can just be something that they're interested in telling people about and would like to hear ideas. And we hope it's a bit of a professional development resource. I suspect people who are faculty of public health members I certainly do put it down on my CPD record, and also to spread information about research funding and training opportunities. And I think, as I said before, we have these approximately monthly virtual meetings. Everybody's welcome. Because we can have a lovely thing about virtual meetings, you can have as many as you want. And we have mailing lists, and I just forward on things that I think that might be useful to people. I'm having to do less and less translation of them now, fortunately. First I had to translate things that came out from NIHR, and I have less of that now. So that's what we do. So if anybody wants to join the Public Health Research Network, they can join this mailing list. Happy to add you. And we get good attendance at those meetings. They are really quite well attended and quite, quite interesting and quite vibrant environment to talk about your ideas and challenges of developing research capacity and culture. So before I finish, I just wanted, acknowledgement's really difficult because then you start worrying about who you've missed out. I just wanted to give a shout out to the ARC team who've really helped me develop this public health theme hugely, as have the public health theme public advisors, Joe and Saba, and of course local government offices in these six councils. Of course, I'm now thanking just about everybody because that's thousands and thousands of people, but there are lots of people who've really helped push this agenda forward and worked extremely hard to, in the face of really quite challenging barriers, to make research happening. So thank you very much to all of you. So that's me. That's my email. Please do contact me if you wish to join the mailing list or wish to talk about your research. And again, I can't promise to provide research support to everybody who comes to me, but I can perhaps point you in the right direction.